Hey, hello, welcome to your GP Gulf Guide. So, here we will be learning together for every prometric exam. So, basically, the base, the clinical knowledge that we need to crack any of the prometric exam, like the Oman prometric, the DHA, or the SMLE, everything is pretty much similar. So, the criteria that is we need to know, we need to have a clinical background, we need to have a clinical base, that is the most probable possible thing that we should have. And every forte is tested, basically medicine, pediatrics, gynecology, obs, and surgery, everything is tested. But the thing is, the medicine part is very huge and very vast. So it is better to give more importance to other subjects, because medicine will overlay with all other subjects as well. So you will somehow get a score in medicine. So it is better to give more importance to other subjects also. So first of all, we are actually following back to forward method, which means that we'll be solving some questions from the ALA note. Maybe most of them might have heard about the ALA note. There are so many things which is wrong in this book, but this note, but still you can use it as a thing to move forward. So first thing first, so now we are starting off with what we call the obs and gynae part with the ALA note, and then simultaneously we will try to cover the MTB as well. So we will start with the ALA note of the obs and gynec part. So the first question here is the contraindication to pregnancy. So the first thing is the first question, as you can see, that the drug should be avoided in pregnancy. So here they are asking what drug should be avoided in case of pregnancy. So basically there are a lot of drugs that is contraindicated in pregnancy, but majority of the times the question comes from which antibiotic should be avoided. So here you can see the antibiotic that is contraindicated, like chloramphenicol, fluconazole, quinolones, sulfonamides, tetracyclines, trimethoprim, and macrolides. So based on each, you can see the tetragenicity is there. That is, chloramphenicol is causing gray baby syndrome, fluconazole is tetragenic, the quinolones is causing arthropathy. So basically, that is what is looked forward to. So these are the drugs which is absolutely contraindicated in pregnancy. Aminoglycosides and metronidazole is relatively contraindicated in pregnancy. So things that you need to actually remember is chloramphenicol, quinolones, and tetracyclines, because it is asked majority of times. So chloramphenicol, quinolones, and tetracyclines. So these are the drugs that you should always remember, and this will be there in the options. And most of the time, antibiotics is the stuff which is asked, which drug is contraindicated in pregnancy. Okay, so next we are going back. So that is about the ciprofloxacin. Here the answer is the ciprofloxacin. So the next question is, female with G3P2 had previous CS due to breech and one vaginal delivery. She is at 34 weeks and fetus is breech. She wants to do ECV. Okay, ultrasound shows anterior low lying placenta and amniotic fluid of 4-digit examination normal, amniotic fluid of 4, I think, and digital examination is normal. What what's the contraindication for ECV? So here basically the questionnaire is asking you what is the absolute and relative contraindication for external cephalic version. So again, here you can see there is two things here. The weeks is given here, but that is to confuse you, because you know that the ECV is done in later stage of pregnancy, but 34 weeks is given here to just to confuse you. Okay, and also that's saying a breech presentation, but the contraindication and the relative contraindication is something different. As here you can see, in absolute contraindication, you see multiple pregnancy, antepartum hemorrhage, placenta previa, rupture of membranes, then fetal anomalies, deflexed head. Okay, so if the patient is having multiple pregnancy, antepartum hemorrhage, that is last 7 days there is bleeding PV or something like that, placenta previa, that is low-lying placenta, which you have seen in this question, ruptured membranes, fetal anomalies, deflexed head, and other indication for cesarean section. So in this case, it is absolutely contraindicated. And some relative contraindications are previous cesarean section. That is, the patient have underwent cesarean section in the last pregnancy. Then IUGR, that is intrauterine growth restriction. There is severe preeclampsia and rhesus isoemulation, that is RH incompatibility or obesity or macrosomia. In this case, it is relative contraindication. There is no thing like lay, or there is no thing like only the deflex head is there, then otherwise fetal anomaly is there, and then you can see there is no weeks mentioned over here. Okay, it is just the placenta previa or low lying placenta which is considered here. Okay, so next thing is 36 to 38 weeks in nulliparous women and 37 to 38 weeks in multiparous women is performed in 36 and 38 weeks, over 36 to 38 weeks. Okay, it can be repeated in one after initial trial is failed and only done where CS facility is available. Only in a hospital where CS can be done. In such cases, only you can attempt an ACV. Complication should be always explained to the mother. The first thing is premature rupture of membrane, premature labor, preterm labor, and abruptio placenta. These are the complications that should be explained to the mother before doing the ECV. Okay, so that is about it. Now we'll also look into something called as placenta previa because that was a question. So in case of placenta previa, there are actually four types majorly. First one is the normal placenta. Next one is a marginal one. As you can see, the placenta is somewhere, it is not touching the os over here. Okay, in the normal placenta. So the placenta is in another position, and you can see the baby's head over the internal os. But in the second case, you can see the end of the placenta is touching the margin of the internal os. That is why it is called marginal. And next one, you can see 50, more than 50 percentage of part is covered over here by the placenta. Then it is called as partial, and there is total where the complete area is covered by the placenta. So that is a total placenta previa. There are four types of placenta previa based on type 1, type 2, type 3 and type 4 based on how much the internal os is covered by the placenta. Okay, that is that. And now we will move on to the next question. So I am skipping this question, the contraindication IUFD wala question. I don't want to make you confused with that question, so I'm skipping that. So next thing is about which one of the following is uh, the vaccine which is contraindicated in pregnancy. So you should know that all live vaccines are contraindicated in pregnancy. The first thing that should come into your mind is live vaccines. Live vaccines is always contraindicated in pregnancy. So here you can see the live attenuated vaccines. So the memnionic is boy love the crime. So B for BCG, O for OPV, Y for yellow fever, the T for typhoid, C for chickenpox. Chickenpox is otherwise varicella zoster. Then R for rubella, I for influenza, M for mumps and measles, and E for epidemic typhus. So remember the memnionic, boy love the crime, BCG, OPV, yellow fever, typhoid, chickenpox, rubella, influenza, mumps, measles, epidemic typhus. Okay, so that is important, and we shall move back to the question. So here you can see everywhere the varicella zoster is given as an option. So that is it. In between, next we have a question. Which one of the following is an absolute contraindication for thrombolytic? Okay. Pregnancy, hypertension, then intracranial hemorrhage of 2 years ago. Pregnancy and hypertension both are relative contraindication, whereas intracranial hemorrhage is an absolute contraindication. So here you can see the table. So here you can see absolute contraindication, any prior intracranial hemorrhage. It said irrespective of the time, any prior intracranial hemorrhage is considered to be as an absolute contraindication. Then non-intracranial malformation or neoplasia, then ischemic stroke less than 3 months, then suspected dissection, recent surgery, recent head trauma, bleeding diathesis. In these cases, it is absolute contraindication. Then you have relative contraindication. In relative contraindication, you can see age more than 75 years, current, current anticoagulation, pregnancy, cardiopulmonary resuscitation more than 10 minutes, recent intracranial bleed that is 2 to 4 weeks, uncontrolled hypertension 180 to 110 milligram Hg, then remote ischemic stroke and major surgery within 3 weeks. 75 years, more than 75 of age is more important here than pregnancy also, but it is a relative contraindication. More importantly, it is intracranial hemorrhage, intracranial malformation, ischemic stroke, and recent surgery and head trauma, and the bleeding diathesis, which is more important. Okay. So now we will move on to the next question. So the answer is intracranial hemorrhage of 2 years ago, pregnancy and hypertension of like 180 to 110 is a relative contraindication. Okay. So next question is pregnant in her 38 weeks, and 2 weeks ago, mm, she was admitted and ECV was done for her. Currently, her fetus position is in linear and amniotic fluid index is 12. What is a contraindication for ECV in her condition? So the fetal position is the answer, because I'll tell you why it is so. You already know that anything that warrant an LSCS is an absolute contraindication. So here at the position of the fetus, that is a linear lie, is an indication for LSCS. So the fetal position becomes the contraindication for ECV. Okay. So the next question is, woman diabetic controlled developed dysuria and frequency, and urine nitrate and creatinine was high. Which drug is contraindicated? So here there is nothing like pregnancy is not given here, and there is some other addition add-ons here. The patient have dysuria. There is in urine analysis there is high nitrates and creatinine is high. So in that case you can see septrin. Septrin is the answer, because all other drugs doesn't give into something like increasing the creatinine level, but septrin is known to increase the creatinine level, and it is somehow not is associated with septrin. So when you give septrin to a patient already having creatinine high level, septrin the creatinine level will also only increase. So septrin is contraindicated in this patient. Now we will move on to the next question. So the vaccine which is contraindicated in pregnancy, that you already know, that is varicella zoster. Then pregnant UTI drug contraindicated ciprofloxacin, because you can see pregnant came here. Then patient to clinic came to clinic, want to get pregnant. She has a history of epilepsy 6 years and not complaints on non-compliant on medication. And what is the best initial management? So whenever the term initial management comes, what you need to keep in mind is you have to follow the stepwise approach. So when now you can say that you have already took a past history of the patient, where the patient is saying she had some drugs but she is not compliant to it. So you have to take a drug history. So drug history is what is review all medications. So before giving her a treatment, the thing will be taking an history examination, then investigation, and then treatment. So initial management means you would have to do what is first. So first is taking a drug history. So reviewing all her medication will be the first thing that you will be doing. Next is ECV in 34-week pregnant, absolute contraindication. You already know that. Previous CS, that is a relative contraindication. Ultrasound finding of low-lying placenta is placenta previa, so that is the correct answer. CTG finding and gestational age. Okay. Contraindication of external cephalic version bicornuate uterus. Okay, that you already know. The bicornuate uterus is an absolute it comes under the absolute contraindication where there is an anomaly of uterine anomalies, so that is an important thing. Okay, now we are moving on to the questions again. mm, okay, which antibiotic is contraindicated in pregnancy? You can see that is nitrofurantoin, ciprofloxacin, penicillin. Nitrofurantoin and penicillin is not contraindicated in pregnancy. Ciprofloxacin is the antibiotics that is contraindicated in pregnancy. Female use paroxetine in with history of suicidal multiple attempts and depression. Pregnant want to pregnant what to do? Okay. In this case, paroxetine is known to have high risk for miscarriage in pregnancy. So we don't give paroxetine in pregnancy. So what we prefer in pregnancy is SSRI, which is citalopram, then fluoxetine and sertraline, which is the drug of choice in pregnancy with someone pregnant with depression or suicidal attempt. So that is SSRI. So citalopram, fluoxetine, and sertraline is what you should think about. So that is about it. So next topic is preeclampsia. So preeclampsia we would discuss in a different manner. We will discuss preeclampsia first and then solve the questions. So that is the most important topic and it needs a lot of discussion. So that we will continue in the next video. Okay. So till then, take care. Bye.